reminder, you can submit your questions throughout today's presentation. We've already gotten a few. Just type them into the chat box on the right-hand side of your screen. We've set aside time at the end of today's webinar to answer your questions. Up next is Amber Trivedi, who joins us from Bright Pink. Prior to her genetic counseling career, Amber worked as a research coordinator for breast cancer clinical trials at UCLA and Northwestern University. She has provided genetic counseling for the Northwestern Ovarian Cancer Early Detection and Prevention Program and served on the faculty of the Feinberg School of Medicine and graduate program in genetic counseling. Like Dr. Sutphin, Amber works for Informed Medical Decisions, where she manages Informed DNA's client relationship and business development programs. Amber also leads Informed DNA's genetics educational initiatives for physicians and patients. She has a special interest in the unique needs of young women at high risk for breast and ovarian cancer and how this risk factors into family planning and relationships. Amber, please go ahead with your presentation.
Thanks for having me here today. So you've heard from Dr. Sutphin about the genetics of ovarian cancer, and now I just want to touch on some of the ways that being at high risk might impact your decision-making and lifestyle choices. So obviously, our ovaries are so highly tied to our menstrual cycle, our fertility, and oftentimes many of the things that even make us feel like women. And because of that, finding out that you're at high risk often forces you to approach family planning with a different lens than you would have otherwise. And today I just want to go over some of the common questions and concerns that we hear from young women at high risk for ovarian cancer. So on the next slide, I just want to start with telling you a little bit about Bright Pink if you haven't heard of the organization. Like Force, Bright Pink is a national nonprofit organization that focuses on preventing